I'd love to just kind of put this conversation into that context, because I feel like this is really timely right now. There's a lot going on in this space. So from your perspective, I mean, you ladies are, in the C-suite. Was it hard to get there? Do you look around? Do you feel like you're alone? I'm going to toss that out there. I'll start with Judi, who's smiling at me in a nice way, like, please pick me. Go ahead.
So, it's a plus minus. There are days, because of my consulting background, where I was brought in as a consultant to do high-level management consulting and executive strategic planning, where I started looking at that inner circle, if you will, and just learning about how relationships work, and how knowledge and information and intellect really can serve you well. And that's not a bash to say that people don't get there, that people who get there are not deserving. But there's a different relationship, I think, circle that happens. And so when I came into CMC, I was brought in as the corporate CMIO. And honestly, my resume, when it was submitted initially, just said Judi Binderman. And so I had a couple of people who were very surprised when I showed up for my interviews, because they really didn't know whether I was male or female. And so what's been interesting is also that Fresno is very much a small town feel, so lots of people who've been there all their life, all their career. And so when I start talking about other places, it's like, okay, but you don't know so-and-so, and you don't know so-and-so? Well, no, because I didn't grow up here. I didn't live with all these people and all their iterations. So it's a little bit hard to understand, I'll say, some of the unspoken relationships in politics, but in terms of the work that I'm doing, no, because they really do respect that and bring me to the table when there are conversations that they know we're going to be dealing with the physicians. Now, to look at the rest of the staff and their workflows and stuff, I don't get brought in as often as the CNOs or in our associate CNOs. Again, it's a different skill set being a physician versus being a nurse, but there are days when it works really well and days when it doesn't.
I did want to add, I did notice, so I started out actually as a medical director of a hospitalist group. And the person in the C-suite who recognized my ability to do informatics was our CMO, who just happened to be female. And I felt like I worked harder than some of my counterparts. And this is when I compared myself to medical directors of programs across the United States. So I don't know if that was just the nature of growing up as a third child, or was it because I was female that I constantly felt the need to work harder to get recognized? Either way, I think it worked out. I do have to applaud my counterparts, because I feel that they have a better way of drawing the work-life balance, and that's probably something that I'd like to put to test and see if I was a female and I did the same way, would I actually ascend? I wouldn't know that, because I've been in Princeton too long. So
I'm curious to know, so you had said that somebody kind of, your female supervisor looked down and kind of saw this ability for you to do informatics and pushed you into that direction. And I think, like, within health IT in particular, I mean, the number of women who are in that, I mean, look around the room. I mean, like, if you guys have not taken a look, I mean, from where I'm sitting, it's like, I've got, like, I mean, like, this is like, the majority of the women at this conference right here are sitting on this stage. The other two, hey, I kind of want to invite you up, like, but I mean, I'm curious to know, like, so, I mean, as far as, like, practical advice for this crowd here, I mean, how important is that for, I mean, not just women in the C-suite, but other, like, men in the C-suite, to kind of look around and maybe without their, whether it's the gender goggles or not, but to kind of look around and see who might be a good person to kind of bring up or give a different assignment to, or kind of push in front of other leaders so that person gets visibility. Is that a strategy maybe for helping women kind of ascend?
Yeah, I mean, I think we were talking last evening about, do we as women in our positions mentor other women? And one of the things that I've tried to tell my male counterparts is at least just give them visibility, give them a career ladder, not around a new position that has a higher title necessarily, but offer them opportunities also to take on a project. Do something that gives them visibility. I do think that's really important. I think that's a tactical strategy. But yeah, younger women come to me and they say, oh, you have C in front of your name and you really made it. And I said, well, here's the difference. I get invited to the party, but I don't get asked to dance. So part of it is,
What do you mean by that exactly?
so I'm
Elaborate
in,
on
so
that.
I have C in front of my name, but there are a lot of meetings that happen that I find out about later, and decisions that have been made, because they may have been made at a, Sunday morning breakfast that, I haven't been invited to, or on the golf course. And so, I'm kind of the person that would ask herself to the prom and ask somebody to dance. But if you don't know where the music is being played, it's sort of hard to do that. And then, of course, my other favorite dance analogy, and you
This is
you
good.
nailed it last night. Who's the better dancer, Fred Astaire or Ginger Rogers? Well, it's Ginger Rogers because she has to do it backwards and in high heels.
Sorry.
I do think that one good strategy might be, for those in the C-suite, you typically have some succession planning, and maybe have two people in that rather than one, and a male and a female, just to sort of see that if you gave equal opportunity,
Yeah.
would the female rise to the task and, essentially be the right person.
I'm curious out there, you guys, give us a show of hands. How many of you guys mentor somebody? Raise your hand. And do any of you, leave your hand up if you mentor a woman, somebody opposite gender. All right, that's awesome, that's good. I'm glad to see that, that's really cool. Okay, good, because I'm always curious, like whether or not there's like an HR issue waiting to happen, and if that prohibits people from kind of reaching, across the gender divide to kind of pull somebody in. So that's really encouraging, great. I'm curious to know, with you guys, who do you, are you mentored in your organization still, even at the level that you're at?
So right now I am not. I have good relationships with most of our C-suite right now, and so we do one-on-ones on a regular basis. It's not really a mentoring relationship at this point. Before I became part of the C-suite in LA at my former position, I did have a mentor who happened to be another female physician coach who was helping me with the business side of trying to walk into a first executive role. But I do think that I've been asked, certainly by multiple people in our organization, to be a mentor, both men and women. And what's really interesting is that when the guys find out that I was an engineer before I even went into medical school, it's like, oh, awesome. And the women just kind of look at me and go, huh? Like they really, like, you started out in a male-dominated field and now here you are. How do you do that? So for me, it's not being mentored, but making sure that I have one-on-one time with key folks in the organization so that I can try to find out, oh, did the dance happen? Because even if I wasn't at the table, at least if I get the information about the decisions and some of the rationale, I can still move forward. It may not be quite as nice as if I were at the dance, but.
Right. So back up a sec here. So one of the things that you said was that when you first started out in that position, I think before the one you're at now, you had asked your coach about some, like, how to be prepared from the business side to walk into that boardroom.
Right.
And I'd like you to elaborate on where did you feel like you were not prepared? Because there's a lot of, I think it was Sheryl Sandberg's book, Lean In, right? And she's talking about how women are constantly so hard on themselves, and they've got to they always feel underprepared. And they've got to get a degree, and they've got to get training and extra coaching and all this stuff to do certain things that a lot of times a guy will just go and do. So what kinds of things were you concerned about that you weren't ready for from the business side?
Being a clinician, you talk about clinical expertise, and I did high-risk OB, and I did a lot of laparoscopic surgery when it first started really coming into being, and I was doing a lot of research with the instrument companies for reusable handles for female hands, because our leverage is different on laparoscopic equipment. So I had the clinical side and the OR side all nailed, but to walk into a more business interview and be ready for some of the kinds of questions about the future of healthcare, and do you understand the budgets, and do you understand the revenue cycle? I practiced in Phoenix at the height of the managed care era, so I understood all that piece of it, but from the hospital officer side, not as much. And so I was really nervous about how do I own a vertical and really take part of owning that and being part of this bigger team that had nothing to do with me individually and my own skill. It was being part of this collaborative organization and team. And I just felt that I needed some additional coaching for answering those questions. And I'll share a very short anecdote. Early on in my postgraduate school career, I interviewed with Judy Faulkner to become a physician developer at Epic, so I thought. Only to find out very shortly into that interview process that they don't hire physicians at that time to develop their software. They hire them to be demo dollies, to go out and demo the software. And I kept coming back to her going, but how come you're not using physicians if you're designing software for physicians and clinicians? Well, that's not what we do. You understand the system and you go out and demo it and show them how it works, but we have a whole bunch of engineers, and I'm going, I am one of those engineers as well. So it was just an interesting conversation with her about the business of her software company, and not feeling, walking out of that one, just I had bombed that interview because she came at it totally differently, and then recognizing I needed a different set of skills to walk in and face a CEO and a CMO and a COO about how I was going to help them through the IT side.
Do you guys feel supported by the C-suites that you work in?
Go ahead.
Actually, I do.
Okay.
I will say that it's not everybody. And when I look at our administrative leadership, there's a lot of women in there. Our CEO is very encouraging of succession planning and mentoring. So I do feel supported. I still miss the CMO that brought me into the position, because I feel that I got the most out of that. So I do seek mentorship outside of the organization as well.
Okay. Sally, what about you?
Yeah, I think yes and no, and it's the same thing. I think there are, like my direct president is very supportive, but then, there's other people in the C-suite that, they really, even though they know your history, so my dirty little secret is between practice and working for Kindred, I worked for 2 different health plans. Don't look at me like I'm Darth Vader. I know you're all going to look at me like I'm Darth Vader.
But
But
that's like over lunch, right?
but I had all this, health plan experience. But when our company would have leadership meetings, there would be the, all-male panel, and they were talking about managed care. And I was really the only one in the room that had ever worked in a health plan. And so the organizer of that meeting, not so much. So I think it is really person dependent. I guess my view of this is, whether it's gender or race or sexual preference, it's what we all might be missing because of our unconscious bias based on that person. So I know one of mine, I was talking about it last night, that people that dress casually and maybe they're a little wrinkled when they come to the meeting, my assumption is they're not taking it seriously. Now, that's my unconscious bias, and I have
When
to...
you say casually, you're talking like Zuckerberg hoodie, like kind
Yeah,
of that look.
yeah.
Okay.
And so I have had to stop myself and say, you're demonstrating that bias right now in your head. Like, this person could be totally committed to this job, and you can't just look at outward appearance. So I think we all have unconscious bias, and so I just try to call myself on it all the time. But I do think that women do get put in the hands-on caregiving experience for their children, and we were talking about older adults last night. And I was actually overlooked for an opportunity because I care for my mother, and she's in her last year of life. Even though my geriatrician, I have no way of predicting what day is going to be her final day. I thought we had it last Thanksgiving. And then, on the 3rd day, she rose and started eating again. Like, I would not have been able to predict that. So, but I was overlooked because I couldn't commit to moving, because I said I can't move until my mom takes her last breath. And the irony is, it was a job involved in older adult care where their goal is to keep people in their home. So that's ironic, don't you think?
Oh, yeah. Do you think, though, that your gender had an impact on that? The fact that they knew that you were the person caring for?
Yeah, I think so. I think they realized that the kind of care I would provide would probably be more hands-on, and I would have to, get to where I need to get. and there are many men who are in the same position, don't get me wrong, but I do think the assumption is a man has a significant other in their life who's going to manage all that. I mean, and I think it's one of the unconscious biases.
No, I think that that's fair. I mean, as far as some of these other, I mean, talking about unconscious bias, I think that that's a good, thing to jump in on here. And I think as far as strategies for getting around that, I mean, you guys both you and Simran, Sally had talked about how like within your leadership in your organization, there's, there's good support and then there's not so much support. So I think I'd like to focus on the good supportive and how maybe those folks have kind of come around on their unconscious bias or whatever it is, but what does that look like? What does that good support look like when you get it versus the not so great support?
So I'll take that one to start.
Oh, please.
So one of the things that actually surprised the heck out of me, I got a call from our corporate COO, and he said, can you come over to my office? I've got a problem, and I want to talk to you. And I'm like, oh, God, what did I do now? Because I'm not a shy, retiring wallflower by any stretch. So I show up in his office, and I walked in, and he said, I want to show you something. And it was an article in the Fresno Bee, very small column, about how informatics was now reaching out to patients in the community through my chart. And how they had connected it back to informatics when we've been working with primary care physicians in the community, and my informaticists are at the benefits fairs to sign up employees who are part of our health plan. It was kind of interesting, and there was this one comment in there about the vision for connecting all patients to all providers, and he said, that is like one of the most unique and original statements. And I'm looking at him going, I didn't say it, but I'll take credit for it, absolutely. And I said, but that's exactly what we're trying to do, because 2 of the other facilities in our market are switching to Epic, and so the informatics leadership are already meeting to figure out how do we do that information sharing for our patients in our community. So in saying that, one of the things he asked me, which was the first time he had asked, was where do you see informatics going for the future? And we've talked about tactical strategy, but from a vision perspective, and I said, informatics is part of everything that this organization is doing, because your tools are that foundation. And so he sort of pledged his support at that point to say, if you run into people not bringing you to the table to inject that, I want to know about it. Totally blew me away, because he really meant it, and he's a man of his word. So the fact that I was getting that kind of a support to say, carte blanche, whatever you need, you let me know, 2 years into my stay here, was really unexpected.
Well, that's great.
Well, I'm in my 9th year at my company, and for the first time just this week, the person to whom I report had gone to Europe to look at an opportunity, and he came back and he immediately handed me the presentation. He said, I want to know what you think about this. And so it's the leap, I think, from sort of a VP of medical affairs role, recruiting, onboarding, performance management of physicians, education, tool, and support. But being asked to come to the table and lend your ideas around strategy, like that was a big leap. And I don't know if that's gender specific or I needed to be in my 9th year with the company, but I know how it made me feel, and it made me feel absolutely awesome. And, I read the document on the plane on the way here. I've already created my notes, well, this is what I think, and I'm sending it back. So I think part of it is when you invite somebody that's in a minority group to the table, are you really leveraging that higher level amount of contribution that they can give? And so I do think that felt like a little life-changing for me.
No, I think that's interesting because they're kind of similar, right? I mean, so Judi, your example, it's like being asked about kind of the vision for the future of the organization, sure, where things are headed, and then Sally with you in a similar way, but it's like, is this a good investment, or like, weigh in because your perspective, from a business standpoint is important. So even just asking for input sounds like it might be, a valid way to like it just kind of be more inclusive. Simran, did you want to add anything to that?
No, but I feel that when there was a blog that reported the 4 fields that this is most predominant. So healthcare was one of them, tech was the first one, banking and finance was the second, and the last one was education and higher education. So I feel like out of the 4 in banking and finance, they're being very proactive. They're actually trying to find ways that in their hiring process, they're incorporating either blinding resumes or like some concrete objective ways of sort of creating neutrality, whether it be gender or culture or whatever it be. So I just feel like out of the 4 fields, healthcare is waking up. Technology very slowly, but the same. I think when I look at clinical rosters, I remember walking through 2009, I think I walked through the halls of our hospital, and all of the chairs through the years were all men. So I smiled because I thought to myself, all right, I got to see when this is going to change. A few years later, it's still the same. So I feel like, okay, maybe it's time. We have maybe 1 or 2 female chairs. I feel like that area in medicine is still asleep, and probably just encourage the audience at this point that when they go back, they sort of look at what is it really that creates that bias, if there is any, because we don't know.
So even like at all different levels of the organization, what you're saying, because
Yeah.
there's more women at the front line delivering care clinically, but then there might be like a C-suite that's a little
Yeah.
bit balanced, but kind of in that those middle levels of leadership, there may be a little bit of a desert there as far as women are concerned. Okay, so strategies for the future here. Can we talk a little bit about that? I mean, I'm curious to know, so what would your advice be to the gentlemen and few ladies who are out there watching? Is there any one piece of advice that you'd like to offer?
Well, I'd like to ask the question first. Anybody at your organizations, have you developed formal diversity and inclusion councils, or is it somebody's job? Could I see a show of hands? So they've hired some resources. It's somebody's job, right? They're not doing it off the side of their desk. And so we've done that at my company, and the person to whom I report, he's actually the executive sponsor of this. He's Indian of heritage himself, and we're being very tactical. I mean, we had to first meet and talk about what was our vision and what did it mean. And it's not just diversity; it's also inclusion, which is diversity is the party, inclusion is being asked to dance. And we have now subgroups, and we're being very tactical about what we do, from employing new staff to procuring materials that we need in our hospitals and our rehab centers. So we're being very tactical and broad. We're pretty new in this, so I think a year from now, it'll be interesting to find out, have we made some headway?
What's some of the challenges you guys are encountering right off the bat?
I think, we want to kind of boil the ocean, but I think you can say that about a lot of projects. So I do think we have a diversity and inclusion officer that's his job. And so we brought in a couple outside consultants to spend half days with us. And I think it was really their advice around collect data now, make sure you're collecting data. Make sure you're prepared to talk about the so what did we do? And I think that's where we came to figuring out we needed to break into subgroups and get really tactical, and we needed to get really data-driven around it.
Okay. Simran, how about you? I mean, just weigh in. What kind of advice would you give? 'Cause, I mean, I get asked that all the time. It's like, I want to support more women, but I just don't know how. So what would you say?
I feel like sometimes we struggle with stating the problem. So I have to say, I mean, while I've recognized the issue, while I've seen it, I don't think I've voiced it out. So I think starting the discussion would be a good place to start, and letting, I'm going to say, our mentors, or at least the people, our supervisors, sort of know that it is predominant, or you've noticed it somewhere, would be a good start, because if you don't know the problem, you can't even start a solution.
Do you feel, do you want to articulate a little bit more clearly what you feel like for you the problem has been?
I think in my case, I've never voiced that particular concern that I've noticed the clinical leadership has been predominantly such. So I think if I stated that, then maybe I'd get an answer, or they'd say, oh, we've never noticed that. Yeah, we should really look at that. Why is it that way? So I just think that maybe I should start and make that observation known and see where it goes.
Where it goes. Okay. Judy, how about you? Good advice.
So I think one of the things that we've been working really hard with, at least within informatics and starting to move out into our analytics group and our education group, is really looking at skills. And so one of the things that we've asked HR to help us with when we're looking at candidates is to blind their resumes from just an initial and a last name and not have a first name available to us, so that we really are looking at no additional assumptions one way or the other in how we consider a candidate's experience, et cetera. What's been interesting in the last 3 rounds of interviews that we've done is that we've actually gone with more of our female and minority candidates and really are looking at their skill sets for their skill sets alone and their merit. And it was a really interesting conversation with my leadership team about doing that, to say, I think we at least can put into action what we're sort of seeing, because we've talked about it a lot. And so that's one of the things that is starting to gain a little traction as the informatics leadership start working with other areas in the organization. They're suggesting, have you thought about having HR just do an initial and a last name? I don't think we're quite ready to completely blind with numbers our candidates, but it's been interesting to watch how people respond when they sort of get that final reveal about who this candidate is. And they've already made up their mind. This is the person based on skills and what they've done. And the interviews most of the time complete that and solidify that. So it's been an experiment that we've done because I put that conversation out on the table for my team.
That helps you with gender, but maybe not so much with race, because I hire a lot of physicians. And so, when you see the training,
Right.
you go, oh, well, they're a foreign medical graduate, they trained somewhere else. So I think it's hard to get rid of it entirely, but I think that's a really good first step. And it depends on your interview process, but a lot of times, just because you can't get everywhere, you're doing that initial Skype discussion. So I think it's really hard. I think it's a great step in the right direction, but I don't know, has anybody here thought of a better way to do that? Because I think that's a challenge.
Yeah, we can open that up too.
Yeah.
I had a question too for the crowd here. I think it's interesting in health IT in particular, in IT orgs anywhere, you just don't see a lot of women. I think they're maybe more starting to come out of college and get into those positions, but I'm curious about, whether or not the crowd is seeing more women kind of enter into their organization. I think down of the vertical in there, if there's a lot more women that you're seeing coming into tech or IT. So, I don't know. Have you guys noticed a trend as far as that goes? More women coming up? No? Maybe not. Kara's got a microphone. No, not really. So I'm curious then too, so with the challenge of that, how do you, if you're in a discipline where it's more or less male dominated, how can you bring in either different, the perspective of either a different gender or even from a different ethnic group, so that you can have that kind of weighing in and impacting? Do you guys have any suggestions there? So if the IT org and even the people coming out of school are still mostly guys who are coming in, it's hard to find women to kind of even fill these positions, especially on merit, right? Because we want it on merit, but it's hard to find women. So how? Even within within a healthcare organization, are there opportunities for cross collaboration? Maybe in more of a female-dominated vertical. I don't know, I think of marketing as something that's often very female-dominated, or on the clinical side, nursing. Are there ways to bring women in that you've either in your organization seen kind of a cross-collaboration across disciplines that has worked well, or anything like that?
So our IT group has a program with Fresno State, and they do have an informatic or an IT program, and we also have Bitwise Industries, which is sort of a programming program and think tank that grows individuals. And so IT has some summer internships and some additional during the school year programs where they bring in folks. And within Fresno State, there is a STEM program even at that level. And so they are bringing in a lot of diverse candidates for that purpose, to expose them to experiences that they might not otherwise have. Some of that they will then feed off to us if somebody's not quite wanting to be just, and I say that it sounds so disparagingly, just an analyst, but that want to get more into the front line with caregivers to look at informatics. And so they will actively pass them over to us for consideration for interns, internship positions. Additionally, 2 of my nurse informaticists, who happen to both be male, are actively taking on informatics and MBA candidates and master's candidates to mentor for their projects and programs. So we're trying to pull from some other programs in our area. And our foundation development group is very good about referring candidates that they come across as they're doing marketing and development if they have somebody that they think would be a good fit.
Okay.
Well, I think a recent personal experience I'd like to share
Yeah, please.
is that my youngest daughter is a senior in high school, and we've been doing the college tours. She was actively recruited by an engineering school because she received a postcard, and they had a women interested in STEM program she was specifically invited to. I thought, well, now, isn't that interesting? They were going to have a special day for women interested in STEM. She wants to go into chemical engineering. And then when we went to a week-long kind of a rising star sort of program, I was so delighted to see so many young women in that room. And I'll bet you just 5 years ago in the field of engineering, there wouldn't have been a lot of women there. So I do think there's some organizations that are figuring out how to do it.
Yeah, and I just bring that up because I think, like, in my world, I talk to a lot of startup companies, and so, and then, you know, obviously I talk to investors as well, and a lot of times they're like, we love investing in female-led startups because they often bring back a better return. The problem we're having right now is we can't find enough female-led startups. Like, they're just not out there. And so I'm just curious about some of these programs that may seem like, you know, they're starting and targeting, you know, high schoolers, or they're starting in college, or targeting college students, where they're trying to build like that career path, you know, in these certain areas that have not been often, you know, maybe not a traditional pathway for a woman. But I feel like, I don't know how that ends up feeding into these organizations where you guys are at now. I mean, I'm curious about the connection there. So I just wanted to ask that. And see if there was any ways that you saw that the more visibility, or just even more of these more of these events or organizations that are trying to, I don't know, like kind of bring together women or bring together groups of different minorities, or are trying to create awareness and trying to kind of create visibility and comfort for the people who are kind of going into these places where they're not usually going. I'm going to open it up to questions from the floor if anybody has anything. Yes, back there.
So having been a consultant for 15 years before I became an employed physician for an organization, I mean, all of that is relationships after the workday, right? You're going out to dinner, you're having drinks with your clients or your team to try and figure out strategies, or if you've got multiple consulting companies coming together on a project, then trying to get to know everybody. So I think some of it is how you respond to it and draw your own boundaries. My husband used to joke about, okay, your other husband's on the phone, when it was somebody calling from the consulting company to figure out when I was going to be in town so we could strategize for meetings. But I think it was how I dealt with and accepted it, and then said, okay, guys, I'm not going out dancing. I'm going to go back and start getting ready for tomorrow. So I think it's more about how you draw boundaries, because if you automatically exclude yourself from the dance where the music is being played early on, you won't get invited, and it makes it really hard then to even be able to draw those boundaries later to say, well, I'll go that far, but I won't go there.
Yeah, and I really think that question cuts across gender and race. Sure. Kind of whole different track about how you conduct yourself after hours, and but I will tell you, male mentor gave me some advice. And I'm not very good at it, as I tend to be verbose. But he said, you know, if you want to be taken seriously, you say about 1 or 2 sentences and then you shut up. And I thought about that. And if you think about it, it's how a lot of men communicate. You know, they're not going into the third level explanation. And you talked about how, was it hard to get where I am? It took me, I was doing my current role for a year, and it took a year for me to get them to endorse it and formalize it. And, you know, I really got to a position where I did walk into someone's office and I said my 2 sentences and I shut up, and they really didn't know what to do. I mean, I could tell they were shocked. And then to make my point, before I left the room, this was another piece of advice, I looked at this male colleague and I said, and I'm dead serious. And I shut up again. So I think there's just some tactical things that when you see work, people make their point. I really think we need to teach those tactical skills too. I
love
see you
that. I'm
smiling.
dying-
I
I'm
see you
dying.
smiling, Chris, about that whole thing.
I'm dying to hear what those 2 sentences were.
What are
but-
you thinking about? Because Chris is smiling. I think, you know, one of the things that I've done, because it helps me understand how people tick better. Anybody ever read, the original book was Now Discover Your Strengths, StrengthsFinder 2.0. It's just a really quick, easy read, but it kind of nails your top 5 characteristics if you do it correctly. I have all my team members do that because it's really about leveraging the differences. I'm not particularly analytical, so I made sure that the person on my team who's analytical gets pulled to the table for certain projects and decisions and opinions. So I think that's where we need to go on leveraging differences and, you know, sort of try to overlook the gender, race, sexual preference part of all that. I think it really comes back to us all recognizing our unbiased, you know.
Yeah, I think that's
Yeah.
well said. Question over there. I was just.
Yeah, that was something I was thinking about, and I'm so glad you brought it up. I think if we are going to recruit a diverse crowd, and your point is well taken, once they're there, do we allow them to ascend? Do we give them the opportunity and the visibility to ascend to the positions that we aspire for the organization? But maybe it's how we create the job and the job description and the requirements. I think we have a broader thinking about how that job can be done, I think we will have an easier time to recruit, you know, other, you know, gender or race, where culturally they might have home commitments that not all do. So I do think it's a little bit about how we create the position and the job requirements too.
Oh, I'm sorry. I thought you had a.
No, thank
point.
you.
Okay. I want to, I'm encouraged by the fact that both here and in the back that they've jumped on what you had said about how you were kind of coached into changing your style. And I don't know if I'm sure this has been everybody's experience in their career, but I feel like a lot of times, like myself personally as a woman, I've been coached out of certain things as a woman to do or not do in a meeting. So my background, I used to work for a Blue Cross plan, and I remember going into a meeting, and before I went in, my boss, who was a female, a VP of innovation, stopped me, and she's like, whatever you do, we're gonna go in this meeting. And she called this out because I had done this in a meeting previously. She's like, do not offer to bring anybody something to drink when we sit down at this table. And the only reason I had done that the previous time was, you know, we had walked into the room and I was like, I'm getting a water. Does anybody want anything? And as soon as she saw that, I mean, she, like, I did see her whole demeanor changed. And so into this next meeting, she had specifically encouraged me not to do that. And I think it was because it's one of those things that immediately signals you're kind of, you know, you're submissive or you're subservient or whatever it is, and it kind of puts you in a place on the totem pole. And then I think also not only with gender, but with age as well, you know, I mean, there's ageism too, you know, and so you're young and you're a gender, and it was like, oh God, these people are not going to take you seriously. So I'm curious too, if you guys, if either Judi or Simran, if you want to share any advice that you've gotten about that, because I think it's interesting to kind of even just bring that out, because I don't necessarily know if everybody's had that same experience of getting, you know, coached either. I was also told to find a period, like in a sentence, like just find your period and stop. So I'm going to find my period right there.
I'm going to say there's a few, but the one actually that I've learned from the most is my male supervisor essentially told me, well, you know what, the way to deal with that is you should take him out for a drink. I thought, and the bubble in my head showed up, and I'm like, yeah, I don't know, I'm going to make that drink a coffee, but sure. So yes, I think I've heard a few. Pick your battles is probably the best one.
Yeah.
But nothing that nothing really that rises to the surface. You?
Kind of pulling all that together, you have to start building that street cred opportunity early on. So my grandkids, my oldest grandson is now a freshman at Cal Poly, very into robotics and engineering. His younger sister, who at 16 is living the dream in her junior year, she's a varsity cheerleader, she's doing all that kind of stuff, tumbling all that, Miss Social Butterfly. And she came up to me one day and she said, so if I wanted to do robotics, would that be a bad thing? And I just looked at her and I said, no, absolutely, that would be awesome. And she just kind of looked at me and was very surprised. And I said, are you getting vibes other ways? And she goes, they're not inviting me into the robotics club. Like, my mom doesn't think it's a great idea. I said, you go do whatever you want to do, and I will fight to the nth degree to give you the opportunity. But I do think it's that early socialization, but even those women who choose to buck the system, because half of my materials engineering class were female, which was really interesting at Cornell at the time. You know, we all fought really hard, but then we all stuck together doing our homework together and pondering through stuff. We didn't have that same camaraderie with the guys in our class. So even then it was banding together because we felt like we were fighting an uphill battle. So absolutely, it's just, we've got to get that exposure early on so that they feel empowered to get to that point of, now I have street cred because I've even been seen.
I think leading by example is good too. I mean, and that's kind of what we've talked about here as well, is, you know, how do you guys model this behavior either in your organization or even in your own homes and with your kids and with your grandkids. So we are out of time, but I wanted to thank you all, ladies, for this lovely conversation, and then gentlemen and women who are in the audience as well. Thank you very much for participating.